In the third section, now we will talk and discuss about the signs and symptoms of otosclerosis. In this section, we will talk about the pathology of otosclerosis and how otosclerosis is developed. And then also we will talk about the symptoms and also the signs. First, if we go before starting our actual topic, what's pathology is? Patho is disease. So pathology is the study of the disease process, how it is developed and how it progress. Then symptoms. Symptoms are what patient tells you, what patient tells the doctor, and signs are what what doctor can see in the patient. So that's the difference in these terms. Symptoms are what is patient tells to the doctor, and signs are what the doctor sees in the patient. So pathology of otosclerosis. The otosclerotic lesion is usually, if you see in this diagram, it's chalky white, grayish, yellow or red. So this is the picture of otosclerotic lesion, chalky white, grayish, yellow or red. The spongy bone appears in the normally dense enchondral layer of otic capsule. So we already said that otic capsule has 3 layers, endosteal, and then we have enchondral layer. Chondro is from cartilage. So cartilaginous layer in the inner side, usually there is spongy bone formation in that cartilaginous or enchondral layer of the bony labyrinth or otic capsule. Numerous marrow and vascular spaces with plenty of osteoblast and osteoclast and a lot of cement substance. So also what happens is there is formation of vascular spaces. If you see in this diagram, there are a lot of vascular spaces or blood vessel formation, and there is also plenty of osteoblast and osteoclast cells. Osteoblasts are the cells which are bone forming cells. Osteo is for bone, blast are the cells which leads to formation of the bone. So osteoblasts are bone forming cells, osteoclasts are the bone destroying or bone reabsorbing cells. So both type of cells are present that cause destruction of the bone, at the same time formation of the bone, and also lot of cement substance to cement these structures together. So now if you see the pathology, there is formation of spongy bone in the otic capsule by replacing the endochondral layer. There is formation of osteoblast, osteoclast and cement-like substance, and plenty of vascular spaces. Now the symptoms of otosclerosis, or how the patient will present with otosclerosis will present. Hearing loss, we already saw there are in the 2 types of otosclerosis, in the stapedial and in the cochlear otosclerosis. Both can lead to hearing loss. In one we have conductive hearing loss, in one we have sensory neural hearing loss. So hearing loss is an important symptom. When patient will go to the doctor, they will tell, okay, I have hearing loss in this ear, and then further diagnosis will find out that this patient have otosclerosis. So the first symptom that the patient might tell to the physician or to the ENT specialist is hearing loss. Next is paracusis villi. This is the condition, even though patient complain of hearing loss, patients with otosclerosis, they hear better in the loud environment. So when there are noises, normal people, they hear less, but patients who have otosclerosis, they will hear voices better than in the noisy environment. Then there is tinnitus. Tinnitus is the condition in which there is ringing sound in the ear. Patient tells the doctor that I hear ringing sounds in the ear. Vertigo is a condition in which there is dizziness and spinning of the world. So vertigo. And then there are speech problems, and this speech problem is mainly due to hearing loss that is present in the otosclerosis. If hearing is not good, it affects the speech also. So these are very, very common symptoms in the patient with otosclerosis: hearing loss, paracusis villi, tinnitus, vertigo, and speech problem. Here again, this is all these are the, you can see this is labyrinth, semicircular canals, and then this is the cochlea, eustachian tube, eardrum, and otosclerosis of the ear can cause all these symptoms. Next, the signs of otosclerosis. There is reddish hue. Now, all these are the findings which doctor can see on examination. They can see reddish hue. We already mentioned there is chalky, white, yellow, reddish appearance of the ear. So, reddish hue is present. Then there is normal eustachian tube function. Eustachian tube is not affected. Eustachian tube is the tube that connects the middle ear and the throat and the pharynx. And it is responsible for maintaining the balance of the middle ear and the atmosphere or environment. So eustachian tube is not affected by otosclerosis. Tuning fork test shows negative. Rennie test, so the Rennie test is not positive. There is no Rennie test. If you remember, we said Rennie test is performed by the tuning fork, and it is test done to differentiate between the air conduction and the bone conduction. Air conduction is usually longer than the bone conduction. So once the tuning fork is vibrated and it is placed in front of the ear, then patient can hear the sound longer as compared to the bone when it is placed on the mass start process. So this is negative. So air conduction, tuning fork shows negative Rennie test. Then pure tone audiometry, there is loss of air conduction more for low frequency. So as the low frequencies are used, their air conduction is lost. So loss of air conduction. Also, Gerhardt's notch disappear after successful stapedectomy. So once the procedure surgery is performed to cure the otosclerosis and stapes is removed, which is known as stapedectomy. Ectomy is removal. So stapedectomy is removal of the stapes. So surgical treatment is stapedectomy. Once that is performed, the Gerhardt's notch disappear. Gerhardt notch is sudden this going down of the hearing. If you see, this is sudden downward hearing loss. This is becomes normal, and then the hearing gets better. So this is Gerhardt's notch disappear after stapedectomy. And usually the hearing is poor for low frequencies. Higher the frequencies, sound frequencies used, the hearing is better. So here if you see, this is the hearing loss in decibels. This is the frequencies used. So here frequencies, if louder frequencies like 8000 hertz, the hearing is better, and it's going down with low frequencies here. So all these are the signs of the patient with otosclerosis. They have negative Raynaud's test. Conduction is affected, because in this the air conduction is effective, and then there is normal eustachian function, and the lower the frequencies used, the more poor is the hearing. So that was all about the pathology and signs and symptoms of the patient with otosclerosis.